Hi, it's Dr. Jonathan Brown here. I'm going to give a talk today on facial slimming injections. It's used for two reasons predominantly. Number one is for facial slimming. Number two is for people that grind their teeth at night. It can give great relief to people that grind and wear their teeth down. Now, in terms of how we do the injection, I've got a little anatomy diagram here which you should be able to see. And the predominant muscles that control biting are temporalis, the large muscle on the side of the head here, and the masseter muscle, which is the one that lives down here. And they're the main muscles that control biting. Now, when we perform anti-wrinkle treatments, we inject 5 little injections into the masseter muscle. We make sure that we're very safe when we do the treatment. There's a small muscle called risorius which helps open the smile up, and it does this movement. And if you go too close to that muscle, you could easily cause a lopsided smile, like this for example. So when we do the treatment, we make sure we're very safe in where we place our treatment. When you're injecting the masseter muscle, you draw a line between the corner of the mouth and the tragus of the ear, go 1 centimetre below that, and then do 5 little injection points into the masseter muscle. And that's usually done with the patient biting. So you can see on myself, as you bite, you can see the muscle standing out there. And you're looking to do 5 small injections into that area there. In terms of safety, it's not safe if you're pregnant or trying to get pregnant. In terms of risk of doing the treatment, as I mentioned, there's a risk of affecting the smile muscle. Thankfully, in 5 years of doing the treatment, I haven't seen that as yet, and I don't want to see that. And as long as you stay safe, I feel as though you really minimise your chance of that occurring. And the way to stay safe, as I say, is to treat 1 centimetre below the line between the corner of the mouth and the tragus of the ear. How many units to use? Now, as a general rule for a female treatment, we use about 25 units each side. And that's normally 5 injections of 5 units. It feels like a bit of a sting. It's probably the least painful area to treat on the body. In terms of risk of doing it, there's a risk of a small bruise in the area afterwards, but you could easily have the treatment done at lunchtime, go and meet friends, and nobody would know it. You'd have it done. Now, it should last around about 5 to 6 months with the right amount of units. And what is a unit? We often get asked, it's a bit confusing what a unit is. A unit is just a predetermined measure of anti-wrinkle product. And 25 units does not mean 25 injections. As mentioned, there's 5 small injections. Aftercare, you can do whatever you like after the treatment. There's no evidence to support not exercising or not sleeping within 4 hours or sitting upright afterwards. You can do whatever you like afterwards. And it takes a few weeks to kick in. Now, from a tooth grinding perspective, it kicks in a bit quicker, but from a facial slimming perspective, it takes about 4 to 6 weeks. If you have any questions or any more information you'd like about the treatment, go to www.cityskin.com.au. Thank you.